Okay, well, more than happy to. Thank you for the opportunity to be here today. Interesting you say, give me the data on this. I'd love to have been able to talk about other data years ago, where some of the numbers are probably just as great as this is, but it doesn't stand out as much, and I think we're going to have some dialogue later about health status. But the trends over the last, since the first week in January, as of the 9th, we've dropped about 64% in terms of the number of cases that are positive. So the trend's coming down. Now, of course, testing over the last couple of weeks, we didn't test on Monday because of weather. We had a day last week we didn't test. But also, a little unknown statistic is the per 1,000 tested in Dorchester County, we're number 2 behind Baltimore City. We're well over 3,000 cases, 3,000 people tested, and we knew that 3,000 early on when we used to get specific data. So the more you test, the more you're going to find. That's a given. So I'm more interested in my positivity rate, which is coming down now and still below the state average, than I am the case rate, because when you have small numbers, like we're at 32,929, so if you put it in 100,000, that's almost 3 times or 2 times. So the rate's going to jump up. So I'm more interested in the positivity rate itself, what that percentage is and how well we're doing there as compared, and hospitalizations and whether or not our hospitals are able to handle the number of patients. And our hospitalization rate, I don't have it in front of me right now, but it's a bit less than what the state average is in terms of patients. Yeah, and I believe the last time I looked at our other statistics with deaths that we're trending a little bit less than, which is, when you put it in a bigger perspective, overall health in Dorchester, that doesn't, that's not as well, if you will. That's it. My $64,000 question, I think I asked John, I know I asked Angela, is we need to randomly sample these folks. Why do they want to be tested? Is it because we're recommending it? All of a sudden, or another thing that threw us a curve as well, before when we started handing out KN95 masks, and the first week we had them, we had over 20,000. In a day and a half, we went through 20,000 masks. Now, if you look at Dorchester County, and there was a study about a year ago when Hopkins said that we had a high rate of mask utilization, but typically in our population, they don't certain portions don't want to wear masks. So that's dumbfounding to me, but I don't have the answer, but I'm happy to see they're getting the mask. Yeah. At the health department, we're doing vaccinations now. We're still doing boosters. We do some special clinics in the community as well. When you look at the numbers, the latest is on my data for Cambridge is 64.5%. That's the highest. The lowest is Church Creek. The second lowest is Rhodesdale. East Newmarket's about 59%. Toddville 73%. You get down to Fishing Creek where they have a small population. That's 100%. Crocean's 100%. So the pockets we're concerned about are in Cambridge and Harrell, where you have the large population. So
meaning the 2 shots and the booster.
So, no, 2 shots right now. The boosters are a separate count, and so when in the data they haven't thrown that in yet. I think in the cultural response, and the example I would give is that when you look at your health in the community, there's 70% factor, which is behavioral. I.e., when we say to a person, you tested positive, you need to go home and you need to quarantine. Well, you don't think about their household. You go into a household where they have 2 or 3 living in a room together, and you're saying to the person, you need to quarantine or isolate and stay away, and the others need to be quarantined from you. Now, the example I would give, and if you heard the governor talk about the mansion and his wife when she tested positive, they could very easily she's in a bedroom by herself, they drop the food off at the door. So you're looking at the housing issue, and that in our community is an issue. So therefore, what happens? They can't quarantine, so the next thing you have the 5 or 6 in the household all turn positive. That is also in terms of just housing is a big factor in the health, in everyday health, and not only this. So ironically, though, when you look at where we are on health status, the Robert Wood Johnson Foundation they look at all the data sets over, and they tell us where we rank in the state of Maryland. Well, typically we rank either 20 out of the 24, we could be 21, we could be 22. We usually are above Somerset County, Allegheny County, and Dorchester. Dorchester and Caroline will flip at times. And you go back and you look at it, you look at the 70%, you look at our obesity rates are almost number one in the state, smoking, all those behavioral factors that drive that whole health component is there. And so the same thing somewhat applies to this, because what we're asking people to do is that behavioral piece of the side. Number one, wear a face covering, but also wear the proper face covering now that we've learned more about the other face coverings, that they're not as effective as this KN95 that I have here, and wear it properly. It's the messaging piece, which my staff, the Joint Information Center, Angela, and now that we have John on board with us, every day trying to get the messaging out in a way that they understand it. Then you have to depend on those individuals actually wearing the face covering and when they go into a restaurant. And it's a lot of information that they have to figure out in their mind. And so it's all about behaviors. The examples that I give in terms of and you've heard this term mandate, okay? I'll do it from the standpoint of safety belts, as an example. I did work years ago with the National Highway Traffic Safety Commission, and we were looking at what's known as now click it or ticket. And I was part of that research study, and it was being done in North Carolina. And what we were trying to figure out was working. If you ticket a person, will that change the behavior? Anecdotally, we learned this from one lady who was riding down Interstate Highway in North Carolina. She knew the program was in place. She saw a highway patrolman up ahead of her. And so she knew she wasn't buckled. So she buckled. And about 3/4 of a mile down the road, she had a major crash. And the belt saved her life. Well, first, if she knew she was going to get a ticket, she wore it, then she was a believer. That's anecdotal, but the real group we couldn't find in North Carolina at the time was those guys, like where I grew up, my old country boy, and the guys that had the shotgun hanging in the rack of the truck. Country Western Station. So we always in public health who depend on changing behaviors, be it sexually transmitted diseases, et cetera, is how do you reach that person? I know you know what reaches you, I know what reaches me, and scientifically they will tell us, but we don't always know. And that's the same thing you deal with the population we have here. Now, when you look at my vaccination rates, we're not at the bottom. We're like like right in the middle of the pack on that, which is good.
I'll take that.
Yep, so middle of the pack. So some of the other things are in the middle when it comes to COVID, so it's not mirroring what's going on, but I still have the obesity, the chronic obstructive lung disease, and et cetera in the county. And it's all ties back to education. It ties back to that 70%, I need the community to work and own that. I.e., the example I'll give is an infant mortality example. When about 7 or 8 years ago, we had a real trend in infant mortality, and we were trying to zero in and figure out what was going on. We thought maybe it was teenage pregnancy, because those younger kids, when they have babies, sometimes you have bad outcomes. But to show you the example, that committee that I had was very diverse, and the late Henry Wagner, who was our superintendent, he was part of that committee. So it's a committee, it's a community approach to begin to really look at the health issue and how do we own that. And business owners, they have to look at that as well. So I'm rambling. The superintendent, I talk quite frequently, along with my staff and the school health program, which is a partnership with the school system. We have a contract. We provide the school health nurses. And within reason, they're doing as much as they can do. And we've had some outbreaks in different schools. Our focus, the superintendent and I, we wanted to keep kids in school. We think kids need to be in school from a mental health standpoint, but they need to be there to learn. Because if I don't get these kids educated, if I don't get them to graduate from high school, at least that, and get a good job, I'm not going to change the health. Okay, so, but the school system is doing very well. Is it perfect? No. We have a mask mandate. The state put that in place. Superintendent and I had some real discussion about that before it occurred. He and I are always get on the same page. I give him, from my vantage point, where I think we should be. My medical director, my deputy, Dr. Scott, as well, we'll talk with them. And then we'll make a decision, and it's our joint decision, and then we go forward. We're willing to change in midstream, though, if we have an issue with a school. We'll close a school. We'll do something differently if we have to. And that's the commitment of the superintendent. And part of this job I have is relationships, and building those relationships. Sitting here today is a relationship building opportunity. And I thrive more on that than other things that keep me going. So There's no doubt that it's there. I think the challenge is, I know in the hospital system, and we have a weekly discussion with the medical director about what's happening within UMS overall, as well as the shore health piece of that on the shore. It's there, and we got to look at ways to help staff cope, to be more resilient, and they've got to get time away. I think our biggest concern is that I'm doing a lot of testing. It takes 30 to 35 individuals. John even goes out as an example. My other staff are out there directing traffic. But that makes sure that you don't overstress that group. Give them a day off. Give them some time out if you can do it. And we've been able to do that thus far. The hospital system has been able to do that as well. I think yesterday I participated in a webinar with Senator Cardin for all health care around the state and the major association. They were talking about that on the nursing side. We've seen that in our systems here. One of the jobs of the health officer is that the responsibility globally is to assure that you have an adequate health care delivery system, and that includes workforce development, that includes the new freestanding medical center we have here, and giving guidance and helping with structure that. So we've been working on that. It's not a perfect world. Nurses are being treated poorly in a lot of cases, behavior outbreaks of behavior. So we're doing what we can, but right now there's people leaving the field, and the question becomes why. I think the numbers, we've always had shortages of physicians, and this has exacerbated that, and you don't know why individuals are leaving. We don't know that answer, but we're always concerned about it.
You hear in other local level?
I don't think we have any rebellions that I'm aware of. I know that the hospital system did have a mandate. They lost some small numbers, very, very small as I recall. I think what you've got to look at is that when you're having these issues of staffing and et cetera, what can you do differently? As an example, with some of the EMS providers and other businesses now, one of the reasons we changed the 10-day down to 5-day and wearing a mask afterwards and trying to relieve and putting hospitals or whatever other businesses in a crisis where they can keep people working. Because the biggest thing that with this is how do you handle that in all your businesses? I mean, the example, and it was an example early on that your restaurants could do. Originally, they could do the curbside, which was fine. We kind of worked out some things downtown where people could get some parking spaces or whatever. But as we got into one of the local restaurants, we did not close the restaurant. They closed because they didn't have staff. They had an individual that tested positive and another one, so they just had to shut down, not because the health department closed them. What I'm very proud of when it comes to that part of that side of the business, which is not related to this question, but it is that the stress that we felt having to close businesses or et cetera was not as magnified in Dorchester because of the relationship that we've developed over the years with the Chamber of Commerce, with the state's attorney, and other folks in the community. And so when we had an issue at XYZ restaurant, the first pass at that was that I called the chamber, Bill Christopher, we'd get our heads together, and Bill would go out and talk to them. That usually would end it. Worst case was he'd go, and the next time I'd send my staff person out, and it would end there. And there's an example of how you change behaviors, and what Bill Jones, who I'm very proud of, is going to be our next judge. Bill was on board with us, and I was always in contact with Bill and one of our business owners that they got religion, if you will, when he said, well, you got an option. Either you follow what they're telling you, or we're going to court and you're going to pay $5,000. Now, which do you want? So that penalty was there, and we only had to use it in a couple of cases, but it's about relationships. And so with my focus with business has always been, since I've been here in my 25 years, is I want to protect the public's health, but I want you to stay in business. Because if you don't stay in business, I don't want to have my people, folks are not working, and they're not working. They don't, have health insurance possibly, and et cetera. So, long-winded answer to that question, but I think you have to look at all your businesses, not only healthcare, and trying to make sure that they're sure they can keep their employees working. Well, the biggest one that jumps off the page at us is this heroin crisis and the opioid crisis that we're in, because we had to close down our treatment pieces of that, and then we had to figure out how to get that back up and running, teleworking, whatever. You had individuals falling off the wagon because of the way that some of the payment structures were coming in. That was part of COVID. We gave individuals extra money. So they were using that extra money to purchase drugs, if you will, and they're getting into fentanyl. So that was probably our biggest, because my growth rate of deaths went up by 3, I think, this past year, which is, that's a fairly number. When you only had like, I think 10 before, and you got 3, that's a big percentage. Yes, that was noticed. I noticed it in our Healthy Families program, which is a home visiting program, which deals with individuals that are, and moms and families that are at risk of abuse within the family. We had to change that up. So certain programs, we saw it because of what we had to do. The other programs, in terms of, if you try to talk to a person who's now very, very concerned about COVID, and we want to talk to them about eating 5 fruits and vegetables a day, they say, wait a minute, which is what do I want to do? Well, I want to worry about COVID right now. I'm not worried about 5 a day. You want me to quit smoking? I know I've got so many other pressures on me. Smoking is not going. So yeah, they suffered. I'm sure they did. But in terms of our community learning more about what public health does, which has been my agenda in 25 years, to not just have a name behind public health. It's not just that if you have a sexually transmitted disease, that's what they do, or we license restaurants, et cetera. There are other things that we do. And so taking advantage of that opportunity to spread the good word and let folks know, such as I'm trying to do today, about we're more than COVID, but what we're doing with COVID is the same thing we do with other diseases. Well, I don't know. We have to. Can we define what the normal is?
Yeah.
The normal is that, for instance, in our Rotary Club, once we lifted everybody's vaccinated, we went back to meeting face to face, as an example. And one of the things that, since I do not live in the community, we talked about before earlier where I grew up, and I'm a transplant in Maryland as well as for Dorchester. But to do my job, and I remember vividly when I interviewed on a Saturday morning with the previous county commissioners, the only one that was there that's still there today is Councilman Nichols. And I asked the question, if I'm your choice, what's your pleasure? And they said, well, as long as you do the job, we don't care where you live. Because it's a state position, there is not a mandatory requirement that you live in the community. But you can't be in the community, you can't work in this job if you're not in the community. So I said, well, if I'm selected, I will join a service club, and that will become my eyes and ears and avenue into this community. And at the time, Spicer Bell was the superintendent of schools. I came on in March, and in the middle of April, I was a member of the Cambridge Rotary Club. And I say that as an example. For the last year and a half, I've been the eyes, the ears, the voice of the club, in terms of messaging, and Bill Christopher and I, he's a member as well, and we would talk about updates with COVID, what are the mask mandates, how many people can come into a restaurant, et cetera. So it's paid off very much so. And did they really listen to me prior to that? Yes, I think they did. They did. But this one here, I've been asked to do more, and through some of my district Rotary work, which I do, is to talk about distancing, talk about face coverage, and talking about face masking, talk about good hand sanitation, all the things we do every day. So.